We all know intensive care units are, well, they're modern miracles, right? They pull people back from the very edge. But what happens after? After the machines are off, after the patient finally goes home? Well, it turns out that for a lot of people, just surviving the ICU is only the start of a whole new fight, an invisible one. So today, let's talk about that hidden cost of survival. All right, so here's what we're going to cover. First, we'll dig into that hidden cost of survival. Then, we'll define what this syndrome actually is. We'll look at its three main phases, figure out who's most at risk, and finally, we'll talk about what we can actually do to forge a path forward. Okay, so let's jump right in. We're going to start by framing the central problem here, which is this really difficult and honestly often completely unrecognized journey that starts after someone survives a critical illness. So, you survived the ICU. Now what? You know, this is the real question, isn't it? For so many survivors and their families, coming home isn't this big party they imagined. Instead, they're suddenly facing this mountain of new challenges. And a lot of the time, they're doing it with zero plan or support. And the scale of this problem, it's just staggering. I mean, look at this number. A huge meta-analysis found that over half, 54.35% of all ICU survivors deal with something called post-intensive care syndrome, or PICS. And that's just within the first year after they go home. Think about that. That's more than 1 out of every 2 people. And we're not just talking about taking a while to get back on your feet. No, this is way more complex. These issues, the physical ones, the cognitive brain fog, and the mental health struggles, they can stick around for years. Seriously, some studies have tracked them 5 years later and even longer. We're talking about something that can totally change a person's life. Okay, so if you have this whole cluster of challenges, how do you even talk about it? Well, you give it a name. Let's really define this syndrome, because once you can define it, you can start to recognize it and do something about it. All right, so the official term, post-intensive care syndrome, or PICS, came about back in 2010. It was created to describe this very specific thing, and the words in the definition really matter. New or worsening, that's huge. It means these aren't problems someone already had. Then it hits 3 key areas: physical, cognitive, and mental. And crucially, these are problems that stick around long after you've left the hospital. But here's a really important point. The idea wasn't just to create another label to slap on a patient's chart. PICS was really meant to be a framework, a way for everyone, doctors, patients, families, the public, to have a shared language to talk about this stuff, a way to start screening for it, and of course, to kickstart research into these problems that were pretty much just being ignored before. Okay, so let's break down those 3 areas we just mentioned. You can think of them as the 3 different but often overlapping faces of PICS. First up, the physical side. Doctors often call it ICU-acquired weakness, and it's pretty much exactly what it sounds like. It's this deep, all-over weakness that just wasn't there before. I mean, patients can lose so much muscle mass. They're left with chronic pain and this exhaustion that is just on another level. We're talking about a fatigue so intense that walking from the bedroom to the kitchen feels like running a marathon. Then there's the cognitive piece. A lot of survivors call it a constant brain fog, and it shows up in all sorts of ways, like struggling with your short-term memory or just not being able to focus on a conversation. And it can really mess with your executive function. You know, all those higher-level brain skills we need for planning and organizing, like paying bills or even just trying to follow a simple recipe. And finally, there's the mental health fallout. You have to remember, being critically ill is often a deeply traumatic experience. People can experience delirium, terrifying hallucinations, a total loss of control. So it's really not surprising that so many survivors come out of it with anxiety, depression, and in many cases, full-blown PTSD. So this all leads to a really important question. Can we predict who's going to get PICS? Who's most at risk? Well, researchers have been digging into this, and they found some key factors. And what they've found is pretty clear. Each of those 3 faces of PICS has its own main risk factor. For the physical problems, it really comes down to how sick the person was in the first place. For mental health issues, the biggest predictor is if someone had prior mental health challenges. And for the cognitive side, the #1 risk factor by far is experiencing delirium while they were in the ICU. Let's zoom in on the physical impairments for a second. The data is pretty stark. If you had a more severe illness, your odds of developing these physical issues were 2.5 times higher. Being older or being female also pushed those odds up quite a bit. And you can see why this kind of data is so important. It helps doctors spot the patients who need extra attention right from the start.
Okay, so we've defined the problem, we know who's at risk, so what do we do about it? Let's talk about the path forward, how we can try to prevent PICS in the first place, and how to treat it when it happens.
So, one of the most powerful tools they have inside the ICU is something called the ABCDEF bundle. It's basically a checklist of best practices, and it's brilliant. It covers everything from managing pain to waking patients up from sedation a bit earlier, to preventing delirium, getting people moving, and this is a big one, getting the family involved. And the research shows it works. When hospitals use this bundle, patients spend less time on ventilators and have lower rates of delirium, which remember is a huge risk factor. And after the patient goes home, some of the most effective treatments aren't pills. They're things like ICU diaries. This is where family and nurses jot down what's happening each day. For a patient who has huge gaps in their memory, this can be an incredible tool for piecing their story back together and lowering their anxiety. Then there's peer support, which connects survivors with other people who get it. It helps fight that terrible sense of isolation that so many of them feel. So when you put it all together, the best path to recovery really takes a team effort. The experts say high-risk patients should be screened for PICS pretty quickly, like within 2 to 4 weeks of getting home. And from there, it's all about creating a personalized plan. That might mean physical rehab, definitely some psychological support, and maybe even going to a special follow-up clinic that's set up just for ICU survivors.
And really, this is what it's all about, isn't it? Millions of people are surviving the ICU every year, which is fantastic. But it leaves us with this huge question. How do we shift our focus from just surviving to actually surviving well? As our medicine gets better and better at saving lives, the next big challenge is making sure those lives are full and meaningful long after the hospital doors close.